What's going on, everybody? I see we got D. Lynn's in the building. What's up, D. Lynn? Thank you for being here as always. We are live. We're on Facebook, LinkedIn, YouTube, the Diabetes Tour Guide YouTube. We're on Instagram. Roel, what's up? Roel is he tends to toggle between YouTube and Instagram. I appreciate you, Roel. Thank you. Hello to all the Instagram people. I see Cumberland Marketing's in the building. I love you guys, man. We have had such a fun time working with y'all over the last couple of weeks. We're super pumped about this project. And also shout out to you guys with all the work you're doing with Dr. Jenny Rose, who, of course, was, goodness, she was on our Common Sense MD episode talking about direct primary care pediatrics, DPC pediatrics. It's like it's a really, really cool model of care that I personally am obsessed with. And Dr. Rose, I think, is going to open in June, so we're super pumped about that for our hometown over there in Kingsport. Debbie, are you in Australia? I got to put this up there for this. I want my mom to see this. I was in Australia a few months ago, and so it's got to be 9 a.m. your time, 8 a.m., something like that on Thursday. Whereabouts in Australia? Carter, what's going on? Thank you so much for being here as always. Thank you for such hard work today. Let's see, we got a few people in here from the on our team. Thank you guys for all the hard work today. In this week, we're getting ready to head into Mother's Day week, which is one of our busiest weeks of the year. We'll talk about those specials tonight. Linda, how are your gums? They're doing well. I'm getting on the oral health is my jam in 2024. Oh, nice, Queensland. I was just in Byron Bay. Byron Bay, and then of course went to Sydney, and I love Australia. I love it, Debbie. Thank you so much for being here. Connie, what's up? Stan, what's up? Great to see you. Bianca, what's going on? From Middle Tennessee. I love it. Beverly, what's up? Kelly with an I. I love the way you spell your name. Happy birthday to my sister. Kelly is her birthday's today. I doubt she's watching right now, but if she is, happy birthday. My brother Steve, good evening. Good evening to you, brother. Katie, how are you? So good to see you. We need to. I cannot wait. We're gonna make a video of Katie and Carter putting together all these vitamin orders we've been getting. I tell you what, it's like the annex is like our little fulfillment center. I love it. Thank you for all the hard work these past couple of weeks. So much fun. I got one right here. There we go. Super. We got a question around that. Allison, what's up? Great to see you. Velma, how are you? All right, we're letting people are getting in here. Thank you, Cumberland Market. You guys are the bomb. All right, we're gonna let's see where we at. Where are we? Okay. Over there on Dive Into Diet, if you guys check this out, stretching the tibialis anterior. If you want to know what this is and why you should try it, watch this video. Nutrition coach Lucas Schmidt talks about how you can use a wall or how you can use a buddy. You see my brother over there serving as a wall, little team action there. Teamwork makes the dream work. And then one of my favorite interviews, ever. Moms of Type 1. There's Andy on my right. There's my mom, Jenny. Happy early Mother's Day. Talking about being a mom of 2 Type 1 diabetics. My brother and sister are both Type 1s. So kind of takes a perspective of the mother side, which is actually what my brother's play Andy and the Beats was all about. It was largely around that relationship between a mom and her son who was recently diagnosed. But not to be left out of the equation is the dad who's joining us tonight. Is Doc ready to roll? All right, here we go. Let's see.
Yeah, thanks for finally letting me in.
I gotta get my shine a little bit. Like I feel like
You deserve it. You deserve it.
Once the questions start coming up, then they don't need to hear from me, man. They just want the answers from
Maybe
you.
they do.
And
Maybe they do.
So I have to take the first couple minutes just to get my monologue.
Johnny Carson.
Doc, how's the day today? It's good to see you.
Oh, we had a great day. Saw some great new patients, some really good patients today. Some very challenging ones, which I like.
I love that. I know that's every day in all of our offices. Shout out to all the patients of performance medicine. They're the absolute best, which is one of the themes of the episode you did with Dr. Rose around this idea of direct care, taking out the middleman. And it's so cool to see people who are super invested in their health and they want to get better, and they want to see they want to see people like Dr. Rose. So that episode was a lot of fun. I know it was fun for you.
Yeah, I enjoy seeing somebody step out and going on their own and doing a cash practice, and being able to spend more time with the patients, and it's just a great way to practice medicine.
I love it. I see, speaking of that, Rachel's in here from our Johnson City Clinic. Shout out to Rachel. Hope you guys are having fun tonight. Tell Robbie hello for me. All right. What do you think? Should we get into the show?
Yeah. We got any questions tonight? Or
we got some questions. As you guys know, this is a health and wellness Q&A. So if you have a question for Dr. Rogers, we are taking questions tonight, 7 to 8. And we do this every single Tuesday, and I see a lot of regular faces / names in here. So thank you guys for being with us each Tuesday. I see some new ones, which I'm so pumped about. Like our friend over from Queensland. Let's get going here. Let's start off with this one. What do you think about colostrum supplements? What's your thoughts on this?
I like them. I took, when I was having the GI problems post-COVID, I took colostrum, and it was fantastic. I mean, it just has a lot of good stuff in it. You think of colostrum as being kind of like pre-breast milk, with all the good things that come with immunity from that. And gosh, I think it really helped me. I really did. So if you have any GI problems, and the digestion's not totally working as well, there's some other things you are worried about, or you can't get things, that gut lining, healed up, then you got to add colostrum. So it's a very good supplement. Not everybody needs it, but it's certainly something you can think about taking for your gut, for gut health.
That's such a great question. Love the gut health questions. Thank you for putting this out there over Instagram. Let's get to another vitamin question around the Dr. Rogers supplements. I recently got some Dr. Rogers vitamins and noticed that 3 of them, the Energy, Super Vitamin, and Stress, have manufactured dates of November of 23, January of 24, and August of 23. The question is, and the berberine and magnesium have expiration dates. Is there a way to know when the expiration is when only given the manufacturer date? Thank you for creating these great supplements or vitamins. Thank you for supporting.
Yeah, 2 years. 2 years.
Okay.
2 years.
So 2 years from the manufactured date. I hope that helps. Such a great question. Thank you for letting us talk about that. All right, let's keep moving here. For everyone who's with us live, we're going to get to live questions here in just a couple minutes. So go ahead and put those in the comments if you have a question. I see Katie loves colostrum. There we go for the question around colostrum. We are fans. Thank you, Katie, for putting this in there. And
I agree. Grass-fed cows, assuming you're not a vegan or something, but that was what I certainly took, and a lot of good things in there.
All right, let's get to a PRP question. What do you think about PRP under the eyes to help with dark circles for someone who does not want to use filler? That's an interesting question. What's your thoughts?
It's a great question. Platelet-rich plasma is something that we use for a lot of different things. You can think of that as kind of, I call it a pre-stem cell. So it's coming from your own blood. What we do with it, of course, is draw your blood, spin it down through a special type of centrifuge, and get what I call liquid gold out of it. And you have all those pre-stem cells and immunomodulatory, what you would call factors in there. And we use it in joints. We use it sometimes for erectile dysfunction. We use it. I've had it in both my knees. I've had it in my shoulder, and I've had it in my thumb. Amazingly, it didn't do a lot for my thumb, but I guess because I'm keeping wearing my thumb out playing guitar. But it's just incredible results with knees. Now with cosmetic, we've used it some for cosmetic as well. And I don't like PRP as a filler. But I do like it using the skin pin, needling and then add it to the skin pin. I know Kelly does some of that. So under the eyes with a skin pin, I'm okay, but I'm like you. I do not want filler under the eyes. I've just seen so many bad things happen in that area with filler. I just, don't think it's great in the hands of most people. But PRP, using a skin pin, which is micro needling, I think is fine. I like it. The same thing with, like, I wouldn't use PRP, fill out cheeks. I've done that before for a few people. It just doesn't seem to work as great as a dermal filler, like Voluma or some of those hyaluronic acid products or Radiesse. So think about doing the micro needling with PRP under the eyes. I think you probably like it. It's certainly not going to get into a neurovascular bundle that you don't want to get into, and certainly not going to cause some of the tremendous bruising you can get from that as well. Yeah, good question. Great question.
I love that. I love that strategy as well. Thank you, Doc, for answering that PRP question for us. Let's see here. Christy's got a great question around PRP. We're going to get to that in just a second. Christy, thank you for putting that in. Again, if you guys have questions for Doc, go ahead and put it in the comments. This is let's see here. I believe I have post-COVID that has settled in my knee, hip, and shoulder joints. Goes on to say, I have tried ivermectin, foreign protein cleanse, and nicotine patches, 5.25 milligrams for 2 weeks with just a little improvement. I just started methylene blue. What do you suggest to flush my system of COVID and rid my joints of this inflammation? I've been struggling for around 3 months now. I feel you on this one. Do you need me to put this up right here again? So we
No.
Okay.
I got it. Yeah. I'm sorry you're struggling with it, but certainly COVID sets off some autoimmune processes in a lot of people. So you might want to get some of the inflammatory markers checked, and just to make sure it hadn't, and maybe an RF, a rheumatoid factor, and an ANA, and some of the things to make sure it hadn't set off a major autoimmune disease. But the one thing you should be taking is low dose naltrexone.
Oh.
I think that's my favorite go-to for long COVID, or any kind of symptom, especially something like that sounds like inflammation. It's funny that we've been using it for a long time for various things, and of course we used it for post-COVID, and If you read about some of these elite long hauler clinics like Stanford's, the good article in the journal about this was if you go to Stanford to their long COVID clinic, the thing that they use is LDN. The same thing we've been using for a long time. So, I mean, there's a lot of other stuff you could try, but that is the one I would get is LDN. You could also, use bromelain, nattokinase, serrapeptase, quercetin, but maybe try to get some blood work and see where you're at. But I really think you'd be happy with LDN, which is a prescription medicine. But try thinking about LDN in that situation. It should get better.
And if the person who asked this question is with us live, you can, if you search for LDN Performance Medicine on YouTube, we have a bunch of videos out on it. If you want to learn more about just how we dose it, what the difference between LDN is and just regular naltrexone, because there's quite a difference. Go ahead and check that out, but actually stick around for a little while longer. We're going to be here till 8, so hang out with us and then go watch that video. Real quick, I want to put this up because one, I love Robbie and he's a first time caller, long time listener.
Oh, good.
And
good. Thank you.
Do we have any other, first time callers, long time listeners? Let us know. I hope Robbie might start a little trend here. It's a
fun show. I mean, it's a really fun show. We learn as much as everybody else does from it because a lot of listeners have great ideas.
Like right along the line with what Katie said with colostrum, and I'm sure we'll have some people in here talking about LDN and some of the strategies they've used. So I love it. Thank you, Robbie. Thank you for being here as always. To this day, I've never seen a mustache as amazing as yours. So I love you, brother. Okay, I see on Instagram we got CA Kiwi. I hope I'm pronouncing that right. We're going to get to that question around perimenopause. Thank you for putting that in there. Thank you for all the Instagram people. We're going to get to live questions. I believe we covered everything that came through the week. I also have an eye on my email. If I missed something, remind me. All right, let's keep rolling. Let's actually start with our question over here from Instagram. I won't be able to put it on the screen, but I'm gonna kind of do the audio version for CA Kiwi. Join the fun and exciting season of perimenopause, which is a joke. Tried creams and sublingual. Would love to try the patch, but can testosterone be added if needed? What's your thoughts on this, Doc?
Sure. I mean, testosterone is one of the main hormones that will make you feel good. Matter of fact, I think is the hormone that will make the biggest difference in the way you feel. But as a matter of fact, I had a lady today that she was a new patient with hormones and no libido and moody. And the only thing that was really low was her testosterone. So that's all she needed was testosterone. So certainly you need testosterone. You need at some point, when your estrogen is depleted, you need the safe forms of estrogen. And then you need progesterone as well. And then you need testosterone, and you probably need DHEA. Whether you use it as a patch, you're probably using a combo patch or just an estrogen patch, estradiol. You can certainly add testosterone in a cream. You can do it in a pellet. You can do it in a sublingual or a subcutaneous injection, which is what I did with my new patient today. And she'll be a happy camper. Well, I also use a little oxytocin on her. Okay, no libido, very low testosterone. So I used a little oxytocin as well on her. So she'll be a happy camper.
How often do you, we've talked, quite a bit about oxytocin, throughout the years, but it doesn't come up that much with hormone therapy. How often are you adding that?
When men or women tell me that they lost some of the kind of the connectivity to
Okay.
your spouse, or orgasm problems or things like that. Then I'll add oxytocin, which is a multifaceted hormone that
Yeah.
nobody ever thinks about. We call it the hugging hormone, because it's the same hormone that is used for uterine contractions. That's why we used to call it pitting a lady out. When I used to deliver a lot of babies, we'd hang pitocin, oxytocin, and it caused uterine contractions, and you'd have your baby. But it also helps in milk letdown after you have the baby, and it also promotes bonding between
Yep.
the baby and the mom. So it's just a great hormone. We use it in sublinguals. It's also available in nasal sprays. It's a compounded prescription medicine, but certainly very safe, and tends to work really well.
Such a great question. Thank you. I think that's California Kiwi is what I'm assuming over there on Instagram. So CA Kiwi, thank you so much for that question, letting us talk about that. Let's see if I can get back over. Here we go. Okay, let's get to YouTube here from D. Lynn. D. Lynn, thank you for hanging out. I read where berberine can cause liver issues. What does doc say about it? I think I read too much. I love that. There are liver issues in my family, my mom for one. I hope there is nothing to that. First of all, D-Len, I think it's amazing that you're doing your own research. I think that's foundational.
Yeah.
So what's your thoughts on this?
I haven't seen liver issues with berberine. It's rare that somebody would have like nausea. I had one the other day that had a little nausea with berberine. But one thing, make sure you get the dihydroberberine. You can use a lot lower milligrams on it than you do the hydrochloride version of it, and it's a lot better absorbed, easier on the GI tract. But if you're worried about it, every once in a while, you should have really every 6 months. I think if you're on a bunch of supplements or prescription medicines, you should probably have a metabolic panel, dirt cheap blood test that shows your kidney and liver function test if you're worried about it. But berberine's way, I just don't see it. But it's certainly safer than taking a drink of red wine on your liver. Again, one of the things I like for liver health is there's two things. One is milk thistle, and the other one's NAC. Those are two that I think are great for liver health. NAC really breaks down alcohol too. So if you drink a lot of alcohol, take NAC.
I love that. Great question there, D-Lynn. Thank you for putting that in there. And yeah, that's another thing. Now NAC is the Life Extension has a anti-alcohol. Is that what it is?
Yeah, that's NAC. Yeah.
Okay. All right. Thank you, D-Lynn. Let's go over to Facebook. Velma's asking, I know 2 early 40s males who are having hair loss and receding hairlines. Your suggestions for hair growth? Great question, Velma. What's your thoughts on this?
A lot of times there's a male pattern baldness, which you think of as on the crown of the head, and then you have receding frontotemporal hair loss. And I see it in females as well. It's usually, a lot of times it's genetic. If your parents, they say especially your mom's father, but I don't know if there's much credence to that, but seems like there may be. But yeah, it's so common really. By the time men are 50, half are going bald. So yeah, there's a lot of strategies. And again, the earlier, the better. Certainly like minoxidil, which orally, 2.5 milligrams. I take it. Andy takes it. I don't know if you take it or not.
No.
Take your hat off. Let me see your hair for a second. Are you going bald? That's a redneck toupee. And take your hat off and let me see if you have any hair. Yeah, you've got great hair.
I got a little bit of receding right there. A little receding.
Well, not much. Yeah, you've got great hair. But they do call that a redneck toupee as a ball cap. You're growing your hair out, aren't you, Ben?
A little bit, but I'm not on what Andy's on. Just an
Andy's hair
amazing.
is so thick, it's amazing. And he said he was getting thin.
I
But
don't believe
anyway,
that.
um, certainly I like oral minoxidil, which is Rogaine in a pill. I don't like Rogaine topically. Nobody's going to keep using it. It's too messy and doesn't work as well as the oral. There's a couple contraindications to the oral. One is if you have heart failure. It's rare as hen's teeth to cause something like that. The other one is if you have too low a blood pressure, because it is a blood pressure medicine. But if you're worried about that, start at 1.25, and then the normal dose is 2.5, 2.5 milligrams. It works great with very little side effects. The other thing I would certainly add is a little bit of finasteride, which is really a DHT blocker, dihydrotestosterone. And when your DHT level gets too high, it causes two things: hair loss and prostatic enlargement. So, if you take the full 5 milligram that we use for enlarged prostates, it'll really kill your sex life. So, take a fourth of the 5 milligram. That's a cheap way to get it. Instead of taking the prescription 1 milligram, it's all a prescription, but get the 5 milligram and just quarter it and take a fourth of one every day. That'll block that down. Other things I would do, we have a vitamin for that called Happy Healthy Hair that's got some great stuff in it. We researched it a lot because a lot of people ask me that because they know I do a lot of hormone evaluations and treatments. But it's got something in it called Anugain that is a really heavy hitter. It works really good. Happy Healthy Hair, and it has the biotin, the saw palmetto, the nettle. It has all the good stuff in it. But the Anugain is kind of the secret ingredient. The other thing I would do is a couple times a week use a dandruff shampoo. It kind of clears out the hair follicle a little bit. And when you shampoo your hair, really massage your scalp.
Yeah.
I think it helps circulation. And then the other thing you need to do is pray you don't lose your hair. But we actually do a lot of PRP to scalps too. I shoot a lot of PRP in guys' scalps, and it grows hair. But if you're slick bald, nothing's going to help you too much except something like a redneck toupee or something. So don't wait too late. If you're getting thinning hair, take action. Some people use a red light, on hair.
Yeah. I saw you talk with Mike Vickers around that. People are wearing those caps. But man, I tell you what, Velma, it's such a great question. I hope this helps your friends. And I want to put this up from Robin Riddle, who specializes in functional fertility, is our nurse practitioner in the West Knoxville office, just for the people who are, in that phase of life, who are wanting to have kids. So minoxidil and finasteride can also have a negative impact on fertility for men.
That's exactly right.
So thank you, Robin, for putting that in there for us. A little context for those who, if you're in your 40s and losing hair, but are still trying to have kids. So thank you for that, Robin. I see, we got quite a few. I see Dustin's using, what is it? I think minoxidil.
Yeah.
Great discussion, guys. Thank y'all so much for that question. We're going to keep moving here. I see Tori's over on Instagram. Tori, so good to see you. Thank you for all that you're doing for us. We're so pumped to get to work with you.
Hey, Tori. Yeah.
Let's see here. Where are we at? I'm going to let's go over to YouTube. Kelly Evans with an I. Hello, doctor. I'm a new patient at West Knoxville office. Thank you so much, Kelly. I'm wondering if you've heard of Derkham's disease before. I was given this as a possible diagnosis, but no one seems to know much around here about it. Derkham's, DERCUMS. What's your thoughts on this?
Doesn't ring a bell. So I guess I'll join the ones that don't know much about it, but I'll certainly look it up.
Yeah.
Very interesting. I have to look that up. I don't know. Usually something will bubble up to the top of my head from way back in medical school 40 years ago, but that doesn't ring a bell. I'll have to I'll have to look that up and see uh, what that is.
Kelly,
Apologize.
what we'll do, sorry about that, Kelly, what we'll do is we'll kind of make a note of this.
Write that down, Ben. I don't have a
Yeah.
pen with me, and I'll look it up.
I'm writing this down for us, Kelly. And if there's any context, put in the comments. I'll be on the lookout for a comment from you. Thank you so much for being with us tonight. Let's go to Christy on Facebook. Can PRP help with severe stage 4 degenerative disc disease? This was brought up when we were talking about PRP.
Maybe. I mean, maybe, there's not a lot of people that are going to go shoot it in your spine. There's some that will. And certainly you can see where it might help. Again, like with knees, if you have bone on bone, it's not going to help it a lot. You need some cartilage in there that'll help it. So it depends. If you have stage 4, it may not be worth it. I know a lot of the orthopods and neurosurgeons are starting to use it in their surgeries after they go clean your joints out. They'll shoot PRP in there or coat things with PRP while they're there. There's some progressive orthopedic docs that'll do that. But certainly, it's viable. It's something that I think is going to work better earlier than later. That's a really interesting comment, though. I'm getting ready to do something on my own back that's kind of outside the box. I have a pretty bad back myself, and I have scoliosis in the lumbar section of my spine. I think he's even flipped up an X-ray up there one time. But with degenerative disc disease, I mean, you get this old as I am, you're going to have some of that. But there it is.
Oh, there we go.
There's my back.
There we go.
Who came up with that? That's my back. That doesn't look bad. I mean, look how crooked that is. You've got L4 and L2s over there, not even. So that's my back, So, but you see the way
that's my back.
I can't believe somebody found that. Who found that? Katie or somebody or Jenny?
I think that was Mom in the green room.
I can't believe that. But anyway, you see the way that's really pulled over there. I think it's a combination because I never had back problems before. 10 years ago, maybe. But anyway, I think that's a combination of posture, poor sleeping habits, and getting older. Maybe, I did a lot of activity and things, but never any back injuries. But anyway, if you look at that, I have chronic spasm on one side of my spine. Ernie's all the time working on it, and it really helps. And I've had Dave Merrill work on it, but anyway, it's spasms all the time. And there's a hard knot there. You can see it through my shirt. The right side of my lumbar musculature is really tight. So I'm going to start shooting Botox in it and to see if I can relax that muscle to where it'll start pulling back. I'm also doing functional pathways, which is a new type of workout program that Ben got me into. But I'm going to get my spine straightened. I mean, there are doctors that go in there and put rods in there. I really don't want to do that.
No,
that's major. But there are certainly doctors. I could go to one tomorrow. He would have me on the operating table next week if I wanted, but I don't want to do that. Unfortunately, I don't have any weakness on my lower extremities or pain in my feet or legs or anything. Just low back stiffness. But in any event, so there's a lot of cool stuff you can do. I'm certainly not against PRP. If you do it, you probably want to do it under fluoroscopy with somebody who does a lot of spinal injections under real-time fluoroscopy. So that's a great question, though. I got off on a tangent about my own back. I'm sorry, but
no, honestly, that's super helpful. And Christy, thank you for teeing us up on this topic, because I know one, back pain is so prevalent as all of us get older, and I'm taking preventative measures just because I've seen kind of what dads had to go through, and so we'll be talking a lot about this, and I'm anxious to kind of hear how the outside the box Botox idea goes.
The other thing I'm working on, Ben, outside the box, I've been working on this for years and thinking about it for years. Because I see a lot of baby boomers my age, and really, we're all stiff. Our joints are stiff. You don't move like you used to. You're not able to sprint like you used to, which is the aim of the functional pathway workouts that I'm starting. A lot of that's has to do with myofascial release and that kind of thing. But I'm going to come up with a pain vitamin. I'm going to come up with a pain supplement vitamin that I'm going to just throw the kitchen sink in it. All these other combination vitamins that I've come up with, and now we have freedom to formulate guys that can come up with stuff for me under my specs. I will come up with a pain vitamin, and I'm going to test all different kinds of formulas out. And because really, people that come to see me, or most doctors, either they hurt or they're tired. Those are the two reasons people like to see doctors. So, I'm gonna make a commitment to come up with a good one.
No, I'm glad you're bringing that up on the show. One, because there's quite a few of us here. I think there's 75 people here with us now, guys. Let's hold him accountable to that. Would that help anybody? Anybody out there struggling with pain? I know. Again, I am, and I'm 38. But thank you, Pop. Thank you for mentioning that. Let's see where are we at? I'm lost my place. I wanted to put this up from Kelly. She gave us a little context here. Derkim's disease, also known as adipose dolorosa, rare disease typically characterized by development of painful subcutaneous adipose tissue deposits of different size. Thank you, Kelly, for putting that in there. Is that kind of ringing a bell? Anything like anything coming to mind here for you?
Wow, that's interesting. I'll have to do some. I don't know the etiology, if it's an autoimmune disease. It almost sounds like neurofibromatosis, which is also called von Recklinghausen disease, if you've ever heard of that. But we'll look at that. Since you spell your name with an I, Kelly.
I love that. That's exactly right. My sister's name is Kelly with an I. So Kelly, we're gonna help you out with this at some point. I got it written down. We're gonna do some research for you.
It's very interesting.
All right, I see a lot of people want the pain supplement. I love it.
Everybody will want it. I just want to make sure it works. You look at that. I mean, if you ever watch Fox News, which everybody watches, they have this. Mike Huckabee always brings on this relief factor. I have a lot of patients who like it. They say it works, and so I looked up the ingredients. It's not much, and the doses aren't even high. I'm going to come out with something way better than that. Just mark my words. I'm going to come out with something good. It may take me a year. I don't know, but
I love it. Let's get to Cleve here. Cleve is asking, are you doing
Cleve? I know Cleve.
Are you doing ALCAT testing?
I sent somebody to Anderson's today.
There we go.
I don't know if you still are there or not, if you sold it, but great place. But are you doing ALCAT testing? We do food sensitivity testing. I don't think we're doing the ALCAT right now for some reason. Maybe it was because of cost or whatever. I know we do Dunwoody. If Katie's still on here, she can tell you if we still do the ALCAT, but we certainly do food sensitivity testing, and it's a great thing to get done. I mean, it really surprised me when I did mine. And one thing I'll tell you, if you get that test, be ready to change your diet, because what I found is a lot of times you're the most allergic to foods you like the best, that you crave the most. But there is hope, because usually it's really your gut microbiome causing the problem. So what I've found is if you cut those offending inflammatory foods out, then in the meantime, heal your gut through various things. Okay, Katie says, or Carter says, it's just the Dunwoody. I'm sure we could probably dig up some ALCATs, but for some reason we're now doing Dunwoody. But we find that you can reintroduce it later. And I usually like to microdose things when I get somebody back on the food that they were allergic to. And again, this isn't a food allergy. It's not an IgE mediated thing. It's more like it's a delayed food sensitivity. And that's the beauty of it, because the beauty and the curse of it, because you don't know if you're sensitive to that until a day or two after you ate it. So you're not going to eat, drink milk and, you have stomach upset. It's delayed, so you can't really correlate it. That's where this test comes in, because you'll know what to avoid, because it's very hard to tell what you're sensitive to, because it's not immediate. And so you can try an elimination diet. But yeah, the food sensitivity test is a great test. Good question, Cleve. Hope you're doing well.
Thank you, Cleve, for being with us tonight. And I hope that helps a little bit. Thank you, Carter, for putting that in there for us. I want to get to Debbie here from Australia. Debbie is saying, I'm a type 1 diabetic and have been hit with COVID several times in the past 3 months, and I'm finding it difficult to regain my energy levels. Can you recommend something to combat fatigue? Well, Debbie, thank you so much. You're in the right spot. My brother has type 1. My sister does. And you've probably seen the diabetes tour guide. So thank you for being with us tonight.
All the way from Australia, which has to be the most beautiful place in the world.
Yeah, it's gorgeous.
I just watched a movie about Australia this past weekend, and you were just over there for a friend's wedding not long ago. And you were what was the place you were at? What was the?
I was in Byron Bay. Debbie's in Queensland. So I was in Byron Bay and Sydney, essentially.
What was that, Byron Bay? And then you went up on a ferry to another place that
what was that? Hamilton Island.
Hamilton Island, which when you mention that to an Aussie, they all go nuts. So that's the best place in the world.
Yeah.
But just gorgeous. It has to be the prettiest place in the world. But in any event, that's not the question. That's odd. You've been hit with it several times in 3 months. You must not be developing much immunity to it for some reason. So you need to look at your immune system. But my one thing that I would definitely get on is methylene blue. I mean, that is a lifesaver for a lot of people. You're not going to die of this, but it's a lifesaver, meaning getting your energy level back. Read about methylene blue. I did a podcast on it recently. It was one of the biggest podcasts we ever did. I love methylene blue. I like low dose naltrexone. It's odd that, I guess you're saying that you've tested for COVID several different times in the past 3 months and had different episodes of it, but you may just have not gotten rid of it the first time and have some long COVID symptoms, and you're still maybe testing positive. The tests those nasal swabs aren't really that accurate. I don't trust them. You can certainly do some titers, through your serum, but, it's not a doubt that type 1s have lowered immunity problems. So, and things I like for that are, of course, of NAC and quercetin, vitamin D, vitamin C, zinc, copper, all those things I would definitely do. And I like boswellia. I like serrapeptase along with zinc. That's something I give to people that want to clear that spike protein that persists after a jab. But try methylene blue over anything. I'd try methylene blue, and then probably I'd get on low dose naltrexone. Low dose naltrexone will help your type 1. I mean, both Kelly and Andy both take LDN. They love it. But certainly look at your immune system. Make sure you're getting enough rest, enough sleep. Make sure your diabetes is under control. If your sugar's running really high, it really affects your immune system. You come down with everything. Vitamin C. Vitamin C is huge. We give a lot of IV vitamin C in our office almost daily. A few rounds or maybe just a couple rounds of high dose IV vitamin C would really help you. But I hope that helps. Or certainly, I don't know how much of this they're doing in Australia, but probably quite a bit of it if you find the right clinic.
Debbie, I hope that helps, and keep us posted with how you're doing. Like I said, we do this every single Tuesday, and any way we can help, we will. So thank you for being with us this morning where you're at on Wednesday. Let's get to Deborah here. A family member has, for a few months now, not been able to eat, and the smell of beef of any kind makes them nauseous. What would cause this? They have always been a beef eater. That's super interesting. What's your thoughts on this, Doc?
We saw that a lot with long COVID,
Yeah.
probably came from COVID. I had a nurse that really could not, every time they smelled anything beef, they started throwing up immediately. So probably COVID. So the things I would do are just what I was talking about, treating long COVID. There's a weird type of tick bite that can cause you to be allergic to beef too. It's not too uncommon. So check into that, but I don't know why I'm blanking out on more information on that. I need to do a podcast on that. But yeah, try all the stuff for the long COVID. Low dose naltrexone would be the first thing. And there's some other weird syndromes that can cause you not to be able to smell and taste. And a lot of times what they're doing right now is using some of the biologics for that. Some of the same medicines that they use for eczema, psoriasis, and some of these, like rheumatoid arthritis, lupus, some heavy hitters. They're even advertising it for that purpose. So you might look into the biologic if the regular stuff doesn't work. But really interesting. I like nicotine patches in this case too. You might try a nicotine patch. I've seen that work a few times.
Deborah, I hope that helps. We have definitely seen that. So thank you for putting that question in there. I know you're not the only one who has seen it. Are you guys seeing me okay? My Wi-Fi is kind of going in and out. Are you seeing me okay, Pop?
Yeah.
Okay, cool. All right, we're going to keep moving here. I see Steven's got a question. I'm going to get to Crystal on Facebook, then I'll get to Steven on YouTube. Opinion on krill oil pills versus fish oil pills. My husband's lipids counselor said there wasn't enough studies on it, but that was years ago. How would you approach, I guess one's an omega. Well, I guess they're both omegas.
They're both omega-3s, but yeah, I like them both. If I had to choose out of the ones you pull off the shelf, I would take krill. I think it's better. But there's certain great fish oils. The one that I chose for mine is fish oil, not krill. But it's very absorbable. It's pure. And my levels are better on that because I checked my levels than they were on the krill. So we ought to print some handouts on why, that technology is so good with this and why I chose that form of omega-3 to put my name on it. Maybe Katie can get some of that stuff out at some point on the information about the omega-3 that I have. But boy, I get some killer levels, and I only take one of them a day. You don't have to take a ton of them.
Crystal, thank you for that. And Doc, thank you for that answer. And what we'll do is actually a perfect segue. One, I want to do just, we got more questions. I'm going to get to those in just a second. I just want to put this up for all those who are close to an office. We're also doing this over the phone as well. I think our second biggest sale is happening May 6th through the 12th for Mother's Day week. There are the specials there. We're going to be putting this up each week. I guess next week would be right in the middle of it. So if you want to take advantage of any of these specials, please call the office closest to you. If you have any questions, you can put in the comments. We got some of our team with us tonight. And the other thing is, Carter, do we have a discount code for our vitamin store for the listeners tonight? We're going to start doing, for the people who are with us live, we're going to try to help you guys out as much as possible. And we're going to do a 20% off discount, I believe, a 20 or 10. It's going to be live after the show. If you're interested in any of the Dr. Rogers formulas, Digestial's on there as well. You guys can get a little discount. Okay, let's keep going here. I know Steven's got a question on YouTube. Let's see where we at. Let's see where we at. There we go. Stephen is asking, hey, doc, I'm curious what supplements you would recommend for nerve pain that is intermittent after the L5-S1 microdiscectomy. Gabapentin seems to help me. I have an old guitar. I love that. Thank you, Stephen.
Oh, hey, Steve. Yeah, I want to look at it. I want to look at that guitar. As you can see, I love guitars.
Yeah, I love it. Thank you,
Yeah,
Steve.
bring it by. We'll play a little bit. But yeah, of course, I like vitamin B6. That's the main one that I use for neuropathy. I think that would help some. I like turmeric curcumin, another one. I like MSM. Like I said, I'm coming up with that pain vitamin. That'll be what I recommend. But B6 is an odd type B vitamin. If you take too much of it, it can make it worse. So take somewhere between, start out at 50, go to 100. If it doesn't take care of it, and then don't go past 100 milligrams. So that's what I would try. Certainly, and I'll try to think of some other stuff before you bring that guitar by. Maybe I have some other ideas.
I got an idea for you before Stephen brings this guitar by is get
Practice.
a little better at the guitar. Like put some.
Well, I will. I'll play tonight. I'm using my metronome now.
I love it. Stephen, thank you so much for that. I'm going to get to L Feathers on Instagram in just a second. I'm going to put this up from Carter. Thank you, guys. So for all of you guys that are here with us live, we're doing a discount code on our site, performancemedicine.net/shop, for all the Dr. Rogers vitamins plus Digest Shield. LQ10 is the discount code. And what we're going to do each week around this time, we're going to be giving a different code just so you guys can take advantage of being with us live. So thank you guys in advance. The discount code is LQ10 to get a 10% discount on the Dr. Rogers Vitamin Store. Let's go to L Feathers over on Instagram. Thank you guys for hanging out. I see Katie's over here. Tammy, what's up? L Feathers is asking, I had my vitamin B12 level checked and it was 260. What is the ideal level? Oh, ideal level.
No, what was that again? I'm sorry, I got distracted with a telephone call.
Let's see here. L Feathers on Instagram is saying, I had my vitamin B12 level checked and it was 260. What is the ideal level?
That's low. That's very low. Ideal level is anything that over 1,000. I had a patient today, their level was a little bit too high. Actually, I think that's the first time I've ever cut somebody down a little bit on the amount of B12 they were taking. But so, you want over 1,000, 1,500, somewhere like that. But remember, the other thing too, don't just take vitamin B12. If you just take one B vitamin, it kind of depletes the other. So I love B12. I take it, but I also take the B complex and try to do the methylated, methylcobalamin, not cyanocobalamin, methylfolate. So many people have that methylation disorder that just go ahead and get the best, which is methylfolate, methylcobalamin, which is B12. But yeah, it'd be very, very hard to overdose on a B vitamin. It's water soluble. So.
All right, L Feathers. I hope that helps over there on Instagram. Thank you, guys. They'll put this up because they are reminding me it's the QR code. I guess it's not a QR code. It's a discount code. It's valid for 48 hours. This is going to happen every single week. We'll put out a different code. This week, it is LQ10, capital L, capital Q10. Thank you guys for putting that up for us. Let's see, where am I at? If I have another question, if not, man, did I miss one? I don't think I missed any. Okay, we're gonna call it here a show in the next couple of minutes. If you guys have any questions, welcome Wade by the Water. Thank you for hanging out with us on Instagram. I'm gonna put this up once more. For those of you who want to take advantage of the Mother's Day week specials that is happening May 6th through the 12th, we'll be plugging this the next couple of weeks. For those of you who are close to an office, we have offices in Kingsport, Johnson City, Bristol, Fountain City, North Knoxville, and West Knoxville, all of which will be having these specials. Let's see, and you have 1 year since from the time purchased. Thank you, team, for putting that up there for us. Let's see. Laura has a question. We're going to get to Laura real quick. Does lemon water break your fast? I love this question.
No,
yeah.
no. Go ahead and do it.
I love that.
Black coffee won't either, so that's fine.
Yeah, black coffee.
I love
lemon
water.
water.
Very, very healthy for you.
Thank you, Laura, for putting that in there. Well, Doc, man, what a show. Thank you guys for hanging out. Doc, thanks for answering all these questions. I know you got to get to practice for Steven when he brings in the new. There we go. Steven's like, you better get to practicing real quick.
Oh, yeah, I will. I want to use the metronome and, so I can play with somebody else, get the rhythm going. So far I've been more of a solo guitarist. I really want to play in a band, though.
Matt is asking, yes, Matt, I might tonight. I might have a beer. We'll see. It's been
I thought Matt was asking if beer would break a fast.
Matt, you got me there. You got me.
That probably would break your fast.
Matt, beer does. Beer does. Are we going to have dogs close us out, or are we going to close it out ourselves?
The dogs are coming over. Come here, Ike.
There we go.
Yeah. Here, Ike. Come here. Hey, buddy.
Guys, as you know, Izzy and Ike
close the show with the dogs.
That's Ike right there. Ike's our beautiful one, our sweet eldest child.
He's beautiful, and here's Gorgeous right here.
There's
I call
Izzy.
her Gorgeous. I call her Gorgeous.
There's Izzy. Come on, Izzy. Don't be shy.
Man, Izzy's getting heavy.
52 pounds.
She's 52 pounds.
52
Wow.
pounds.
She's a mini. Yeah. Oh man, she's heavy. I've got a bad back, as you saw.
That's Izzy right there. There's Mama.
All right.
Real quick, thank you, Cleve. Thank you, Connie. Thank you, my brother Steve. I want to say happy birthday to my sister Kelly. I hope it's the best day ever. I hope you guys are having a blast. I know Andy's, I believe, there now. Grandma Mary's in here. Grandma Mary, I love you. Cherry, thank you. I love you. Dad, man, thank you for doing this.
Love you, Ben. Good night. We'll see you shortly.
All right, guys. To all of our team, Katie, Carter, I saw Rachel in here with Robbie. Robbie, thank you so much for being with us tonight. Robin, thank you so much for being with us tonight. Thank you guys for all the hard work y'all are doing in the offices. I got to put this up for my man, Nate. Nate wants you back on tour with him.
Nate is a great musician. I hope you're doing well. He's up in Lexington.
I love
completing his
that.
residency, and yeah, we need to get that. I want to play dueling banjos. That song. You're on banjo, I'm on guitar, and Ben will sing. But yeah, I hope you're doing great. Just an incredible banjo player.
Nate will make anybody look good. If you play with Nate, you'll automatically be good. He's unreal. So I hope we get to see this soon, Nate. Thank you for hanging out.
You're doing great.
All right, let's get out of here, guys. Thank you all so much. We love you. We'll be back next week, Tuesday at 7 p.m. answering your health and wellness questions. Remember, the discount code valid for the next 48 hours is LQ10, LQ10 for those interested in any of the supplements on the Dr. Rogers Vitamin Store. And we're calling it a night. We love you. See you guys.
Good night, man.
Where's my outro? Where is it at?
Don't go away.